once you see how people break down what grounded theory is, then you have a clearer understanding of some of the background reading that you might have to do if you want to adopt any of the research approaches in qualitative research. All right, so let's go to the data collection. How do we go about collecting data for qualitative research? So this is the qualitative research process, right? We start with a planning phase where we think about what research question we want to answer. We decide who are the people that are the stakeholders or the patients or the informers that are best qualified to answer the research question. We then proceed to hear the data collection. Once we know that these are the source of data that we want to collect the qualitative data from. So, talking about data collection, one of the most common ways that the qualitative data is collected is using in-depth interviews. So you see, this is an example from one of the papers that one of the clinical master's students published, Hui Yi. She did a study on exploring the views of adolescents towards a school-based thalassemia screening program in Malaysia. And you can see here that in order to explore what the adolescents in Malaysia thought about being screened for thalassemia within a school environment as part of a national policy, she carried out in-depth interviews with 18 participants to get their views and experiences. So how did she set about conducting these interviews? How did she prepare herself for doing these interviews? Did she just go and ask them what their views and experiences are when they went for a screening program, or was there something more elaborate, some kind of background homework that she had to do? Before we go into the research interview, I just want to ask you to take a look at this picture. Do you know who this is? If you know, then just type in the chat. I used to use another picture of Lance Armstrong being interviewed, and no one knew, at least the students that I was teaching didn't know who Lance Armstrong was. So I have to update it, this picture always has to be made more relevant. Okay, great. Yeah, so that's the ex-prince. Okay, yeah, very, Dr. Manu being based in the UK is very clear to identify the status and most of you have identified that it's Prince Harry and Meghan. So look at this picture. This down ways in which this interview is like a research interview. So in the chat, if you can think of anything that is similar to how you will be conducting a research interview, it'd be good to hear your views.
Voice is breaking. Dr. Lee, your voice was breaking. Can you repeat the last part?
If you can hear, if you can think of ways in which this is like a research interview. Yeah, so quiet surroundings. You can't be too noisy. They feel comfortable. There's some kind of rapport going on. There's a in-depth kind of one-on-one interaction. It's done face-to-face. So of course, online interviews are possible nowadays, especially post-pandemic. So these are some of the ways. What about this one? Ways in which this is not like a research interview. Why wouldn't this be like a research interview? Yeah, so Shanas has a good point of view. Probably the questioning is not it's not based on some kind of a research question. Interesting. So no recording format, but of course this interview has to be recorded. It's on TV. But maybe there's a good point. Our research budget is nowhere near Oprah Winfrey's studio budget. So our recording equipment is definitely much cheaper. No paperwork. Interesting. Yeah. I'm sure they signed some kind of paperwork. It may not be a participant information consent form, but there's some paperwork involved. Very interesting responses. So what is she exploring? Yeah, with the not based on research questions, but based on personal experiences. Well, as you can see in the previous slide, we do also explore personal experiences in qualitative research. For example, the students were asked about their experience with thalassemia screening programs. But perhaps you're on the right track to say that actually when we do research interviews, it's not always about trying to get gossipy news or trying to get people to share something about that the public will find interesting. Very often it's because we are healthcare professionals. We have a focus on some kind of health experience that we want to explore. It may not be of interest to everyone around the world and may not become a Netflix special, but for sure, those topics that we are interested in have a significant health impact. So I think Dr. Navdeep's comment is very valid. So let's look at from that general TV interview and what we've discussed. Let's look at what are qualitative research interviews. I want you to be able to, at the end of this talk, be able to understand that there are different types of qualitative research interviews and be able to kind of like come to an understanding of what style of interview would best suit your research question. Now, the qualitative research interviews are usually, in terms of structure, they are divided into three categories. One is that at one end is structured. So structured interviews use the exact sequence and wording of questions. It's almost like a quantitative survey. And the rationale for that is because they want to minimize the interviewer bias. So this is a very, coming back to our first lecture in December, it's a very positivist view of doing research. You want to be able to reduce the co-construction. You want to be able to reduce any kind of external influence on the data they are collecting. So it has very strict formats. On the other hand, there are unstructured interviews, which have no interview topic guide. And the interviewer, as they converse with the respondent, they explore the topic as the conversation flows between the interviewer and the interviewee. So you have two extremes. You can see on one hand, there's maybe like this one will have 25 questions that have to be asked exactly the same. On one hand, this one may not even have any questions at all, just a general topic, and it's up to the interviewer to go with the flow of the interview. In between these two is something called semi-structured, interview format. Now, the semi-structured interview format, yes, if you can guess already from what I'm showing you, is that they have a set list of questions, but these questions do not have to be asked in exactly the same order every time. So this is generally when you read qualitative research report, it's called a topic guide or interview guide or a topic list maybe. But usually the most common will be topic guide. Now, there are different, from my experience, there are different factors for choosing the style of an interview between structured, semi-structured, and unstructured. So the first one is actually the research question. So if your research question is very exploratory, where you want to do nothing, very little is known about it, you would tend to move towards something that is very more unstructured. So it'd be semi-structured, but there's a lot more flexibility because you're exploring that topic for which little is known. On the other hand, you may already know what's happening, but you just want to be able to get from the respondent a specific set of detailed views about why something is happening. So the how, the which, the who, the how, the which, the who of who's of a particular action or something that you want to explore with someone. So the interview, instead of becoming very open-ended, very flexible, becomes a bit more structured. Epistemology is the other one. I already mentioned this previously, why structured may be positivist and constructivist may be more towards the more unstructured. But there's also the influence of the type of project. If you have a very short-term project, you are probably going to do a very structured kind of interview because you only have one chance to talk to the person. So you want to cover all the questions as much as possible. On the other hand, if you're doing something where you're going to follow up with a particular community for maybe a multiple number of visits, it's more longitudinal, perhaps your interviews become a bit more unstructured. You have space and flexibility. There's also the pragmatism aspect of health research. So in health research, what happens is generally a lot of our research is pointing towards something that's already happening or trying to solve a health problem that's already defined. So we are more pragmatic in nature, and because of this, there's a tendency to move through to try and finish up the questions in order to get the answers that we need to produce a report that's needed to suggest recommended actions in the health in the health condition we are researching. On the other hand, social science researchers may not be so focused on trying to fix things, and they're more interested in the views in the personal, the lived experience of the person, more phenomenological in other words. So they may choose not to ask some questions. They may choose to be more open-ended, more exploratory. And lastly, I think this one should be said that actually I find that, at least for myself, when I was starting out as a qualitative researcher, I always wanted to finish all the questions on the topic guide. I wanted to make sure that I covered everything that I needed to cover. On the other hand, those who are more experienced, I think after a while you get a sense that this person is actually a very key person to talk about. Let's say, for example, for this topic, this particular subtopic. So you focus more on that subtopic with this person, and you are able to be at peace with saying that for the time that I have this person, I'm going to focus on this subtopic because they have the richest experience, and the rest I'm going to explore with other people. I'm going to let it go for this participant. So you can see that structured, semi-structured, unstructured is not always just I want to choose a certain choice. There's a lot of practical realities to it. I'll give you some examples of this, what I mean by the natural fit. Let's say, for example, structured. This was a project that one of my students did. She wanted to implement a decision aid in a hospital setting. And she used a framework that had 14 domains called the theoretical domains framework from implementation science. So because there were so many domains, she just had to go very quickly through the questions. And this made it a more structured type interview. The semi-structured one, this was we developed a module we adapted a module on breastfeeding. And we wanted to see how clinical master students reacted to these three areas: feasibility of the module, the utility of the module, what was the effect of the module learning, and the usability of the platform. So whether the online platform worked well on phones, for example. So we had these three general ideas that we wanted to explore with participants, and so this one was more like a semi-structured. On the other hand, I did one where this was quite recent. We wanted to explore how adherent were different healthcare professionals to guidelines or clinical practice guidelines on colonoscopy within our hospital setting. And for this one, it was very hard to ask the same questions to every single participant because some were very junior. So they would have very, very simple views or very standard views on guidelines. And then you had the more senior consultants who, by the time they were that age and that level of expertise, they had their own theories, they had their own approaches to what guidelines actually mean, and how they view them. So this one was very hard to use the same topic guide exactly for different interviewees. I just want to bring it home by saying that semi-structured interview is the most commonly used in health research because we often have a fairly clear focus. Sometimes we have very large projects with more than one facilitator or interviewer, so we need a topic guide from which everyone works. And lastly, because very often we are interviewing people with time constraints. The patients that we catch may be in between appointments or during the waiting room. So we may not have the luxury of sitting down for a long time with them to do more unstructured interviews. So I hope that gives you an idea of the types of qualitative interviews. The next one is actually, before we actually even start the interview, if let's say semi-structured interviews are the most common, how do you go about developing the topic guide for this? So we need to think about what is the topic guide. We need to think about how we're going to populate the topic guide. And lastly, we need to think about the flow of a topic guide, which is you look at the anatomy of an actual topic guide. So a research interview is a data collection process, which will give you this kind of in-depth information on the participants' views on a very specific topic. And there are two principles that I want to highlight here. So when we go into developing a topic guide, we need to know that each research interview has got a key purpose. It'll be a waste of time if we go into the interview and then you end up talking about everything else under the sun and never get to the research topic, or never cover the topic that we were interested in the first place. So there's a purpose to our interviews. It's going to be one general topic that we're clear of, the RQ, but we're going to be covering this RQ in a set of subtopics. So the topic guide is going to be something that ensures that each interviewee has this general area of information. It's more focused than just sitting down and having a conversation with someone where all kinds of agendas could come in. But there's also going to be, because it's a semi-structured format, a certain degree of freedom with the interviewee. So the focus is important, but the second principle is actually be flexible. So we will usually have a prepared set of questions, but as I mentioned with the colonoscopy example, these are only a guide. And sometimes departures from the guideline are not a problem, but often encouraged. So this one will come as you grow in your experience as a qualitative researcher, that you will sense that for this person that's in front of you, this is the question I need to ask. And this is the area that I need to explore with this person. So some of the other reasons we want to sit down and prepare this topic guide beforehand is it allows us to think through the content, what we are covering. Have we covered all the right topics? The pace of the interview. If we have too many topics for a half an hour interview, we are going to be rushing through the interview for sure. The intensity, sometimes there are difficult topics that we don't fit them right at the start of the interview. We put them later on after we've developed some kind of rapport. The prejudices that we have. So a topic guide puts down some of the underlying bias we see on paper, some of the hypotheses, some of the perhaps even biases that we may have around that topic that we are choosing. We are often very invested in the topics that we do for qualitative research. We wouldn't be doing research on them if we didn't feel very strongly about them. And lastly, the topic guide, we need to prepare it because the ethics committee may very often will want to review what is inside. Yeah. So how do you go about developing a topic guide? You need to start with your research question. So once you have that focus, the first principle of the focus, you then have we usually use three sources of data to put together the topics. The first one is usually a theoretical framework, and then which is the starting point, and the next two, the number two, the literature review, and the third one, the discussion with experts of our own clinical experience. I would consider them as supplementary or secondary, usually to the theoretical framework. So the theoretical framework, if you can find one that fits your topic, it helps you to sketch out the main constructs in your research question. And then that's the starting point. Once you have these subtopics, to build the questions that you need to ask your participants. So you need to be familiar with the common ones in your field. I'll give you an example of two that are very commonly used for our clinical master students. So when they first come in, and some of them do choose qualitative research as their dissertation topic, we usually ask them to look at two. One is the health belief model, and the other one is the theory of planned behavior. So both of these are very simple theories that try to explain why a person would be motivated to do a certain behavior, and breaks it down into some antecedents, some preliminary factors that lead them to do something. So one way that you can get familiar with theoretical frameworks is, this is always a classic book. My supervisor introduced it to me, and I think it's still in print today. It's called Theory in a Nutshell, A Practical Guide to Health Promotion Theories. So you can see that you have all these theories on this side. It's a bit small, let me see if I can zoom it in. Yeah. So you have on one hand the theories which explain health behavior. So these are behavioral theories. So if you're interested in patients and their individual behavior, health belief model, reason, action, or planned behavior, trans-theoretical stages of change, social cognition, this will be good for building an interview to interview individual patients. On the other hand, you have theories which explain changes or spread of the behavior, not at the individual level, but within a community. So you have theories that like diffusion innovation, some community-based theories. These are communication theories. So if you want to explore how a campaign, for example, can change people's behavior, you may want to use these theories here. And then lastly, there are these organizational theories. I just want to add that the one that since this book was introduced to me, and the area that has probably come in the most for theoretical frameworks, especially in healthcare, has been implementation science theories. So I'll just put some here. So CIFAR is a very popular theory. And the theoretical domains framework. So these are implementation science frameworks that combine different theories together. And a lot of the students that I work with who do evaluations of programs or trying to implement some kind of health promotion program or health improvement program would tend to be using either the TDF or the CIFAR theory, which did not exist back when I was introduced to this book. I'll give you a quick worked example of developing a topic guide. Yeah. So I think the relationship between Dr. Abhishek asked, can qualitative research be utilized to develop a theoretical framework? So this one is actually the focus of grounded theory. So grounded theory is opposite of this approach that I'm introducing here. Grounded theory is that the word grounded comes from the ground up. So instead of saying that I know what topics and subtopics to ask, I'm going to go in there as a blank slate, and I'm going to ask questions based on the topic, and from there I'm going to build. Almost, if you think of it, it's almost like some kind of neural network where you start with one dot, and then as you talk to people, different dots emerge, and you're joining all the dots together until you develop almost like a whole overview of that of the area of research. Yeah. But that one is not easy to do. I myself have not done it actually. I'll give you an example of developing a theory from a topic guide from a framework. So this was actually a topic that I was working on. That in evidence-based medicine or evidence-based dentistry, there's always the three main components, which are the evidence base, the clinical expertise, and the patient values. So these three need to be incorporated. And of course, evidence-based, you've got your critical appraisal skills, clinical experience. I think that builds with the individual and their professional experience. But the patient values was always very poorly defined. So we tried to build. We wanted to explore patient values what is the concept of patient values, and we wanted to build it from looking at people who are asked to make decisions about insulin initiation in type 2 diabetes. This was the theoretical. So there will always be either a theoretical framework or conceptual framework. A theory is something that's based on previous research. A conceptual framework is something that's combined together from various theories. So this is a conceptual framework that was based on a number of theories. The idea was that when a patient is asked to make a decision, they have a set of decisional needs, like perhaps they have some kind of conflict, they have values, they have the parameters of the decision, as well as some personal and clinical characteristics. This would then, from their needs, they make a decision, and it's possible to think about the decision whether it's a good quality or bad quality decision based on whether it's informed, values-based, looking at the actions that were taken around the health decision, as well as the impact not just on the health outcomes, but also on the patient's psychology, their regret and their blame, for example. And to make sure that a good quality decision emerges, there was this was a decision support framework. So they said supporting the decision can take place through these steps: clarifying decisions, clarifying values, monitoring progress, for example. And then you can deliver this support through counseling, decision aids, or some kind of coaching by a nurse, perhaps. And so from this this idea of framing what is a medical decision, we built a semi-structured interview topic guide based on that framework. So we asked them about what are the decisional needs, what would they consider to be a good, what motivated them to start insulin, where did you get their beliefs about insulin from. So this was some of the things that were already in the decisional needs component. And then I also was interested in the idea of values. So I not only had this one has a very small segment on values. So I propped it up by looking for a specific theory of values from a psychologist who looked at human values. And so I then mapped, so he said that actually values have a certain set of criteria that define what is a value. For example, it's a belief. It will be some kind of directional thing that guides selection of something. There's a sense of something is desirable, so it's a value. So I wanted to make sure, so with this in mind, I mapped the value characteristics onto the initial topic guide to make sure that I was covering different bases. So I think the idea here is to show you that when you are developing a topic guide on paper, what you're trying to do is to that if you're interested in a certain topic, that you look at literature, you look at conceptual frameworks or theoretical frameworks, and you try to develop a comprehensive topic guide. So constructing questions, once you have your theoretical framework, you then have to try to start to construct your topic guide. And part of this is from those domains in your theoretical framework, you want to be able to construct questions. So questions, I think those of you, of course, who are clinicians, you would already have been very well trained in this, these communication skills about asking. So some of these will be things that are familiar to you. So wording should be open-ended instead of closed questioning, no yes or no questions. The questions need to be as neutral as possible. So I'll give you an example of this one where I just recently reviewed a student's topic guide. She started with a set of hypotheses about what would make Crohn's disease patients move onto a certain diet. And so she had a set of hypotheses that she felt would be the motivators for them to move towards a recommended diet. And the questions that she then constructed were very biased in that direction. Like instead of asking them what do they think about the diet, it would be what would make you start this diet. So you see some of the wording, if you're not careful from your starting point, or if you start from a hypothesis, which is where we are in quantitative research, you might end up breaking this rule. Questions should always be asked one at a time. It was common for me in my early research career that I would ask double-barreled questions. So I would ask two questions, and then the answers, when I was doing the analysis, I wouldn't be able to tease out which question actually the participant was referring to. So I learned to slow down and avoid asking two questions. Questions need to be worded clearly. And I think those of us who operate in India, Malaysia would know this, that this is very important. I'll give you an example of insulin, the one that research I was doing. So I asked the clinic to help me recruit patients who were asked to start insulin. And I remember that patient, she didn't understand. She said, I've never been asked to start insulin. And then I was getting very frustrated. And then eventually I realized that when she talked about insulin to a doctor, she called it the injection medicine. So, or in Malay, it's ubat cucuk. And so then from there, I adapted to fit what the participant was understood about insulin. So you want to construct a topic guide with these questions, but you want to be able to set up the topic guide to be as neutral as possible, so that you probe the informant or the participant to speak without injecting so much of yourself into the interaction that you only get a reflection of yourself in the data. So this is an important point. So the probes. So you imagine you're constructing some questions, and then each question will have a subset of probes or mini topics that you might want to explore under that particular small topic. And if you put in too much detail, you're almost like telling the participant this is what you have to answer, because it's already structured in a certain way. Now, the probes that you put in the topic guide are subtopics under the main topic, and they function only, at least I advise my students to only use them if the participant is stuck. So let's say you have 4 factors that usually influence a certain something. Instead of asking the person, let's talk about these 4 factors, you could leave it open-ended at the start. Can you tell me about what do you think influences this type of behavior or these views? And then only if they miss out any of the probes, then you ask them in the interview. So those are your question construction. So you have a theoretical framework, you build questions based on those principles. And then the last one is this interview, the anatomy of a topic guide. So there are 3 parts to an interview guide, and this one I'll just go through it very quickly because this is quite self-explanatory. There's always the introduction, there's the list, and then you move to the body, and then the last one is some kind of wrap up or ending. Usually it's to thank the participant and then to say, do you have anything else that you want to add to the topic? So the introduction is not, you're not really collecting data for the interview, but you're doing some ice breaking. You want to make sure that the participant is focused on the research question and objectives, even if they've already read the participant information sheet. You take consent, you lay down some of the ground rules that you hope to observe during the interview, and then you can remind them that any questions they have about medicine or about dentistry, you can ask it at the end of the consultation, especially if they know that you're a healthcare professional. The body of the interview guide is actually the key one. You want to aim for a cascading or natural flow between the topics. You want to have the main questions, as I said, together with probes as prompts inside the topic guide. Wording is important, and then this is a rule of thumb that is not in any book, but I kind of use it. Is that the topic guide should be something like 2 to 3 pages, so that you are not too stressed out about having to cover too many questions. There's always iteration possible in the topic guide. So this is quite different from quantitative research, where once a question is set, it cannot be changed because it then changes the validity of the respondents' responses between versions. But qualitative research is always iterative. So as you go with your original version, you find that perhaps it needs to be adjusted, save a second version, save a third version, and so on. So this is an example of an actual topic guide. This was on this was a topic that I did on recurrence of ovarian cancer. So you can see that this was the introduction. It wasn't actually about their choice about medication at cancer occurrence, but just some background of after they completed the initial treatment for ovarian cancer, what kind of follow-up was arranged for you. So these are example of prompts. So this may not be asked unless if the participant already responds to these. You can see another one. This is usually quite common. I do a lot of research on decision-making role. So this will be standard that there's usually a healthcare professional, a family member, peers, and the patient themselves involved in the healthcare decision. So instead of asking them one by one, it's an open-ended discussion, and these are prompts in the topic guide. This is another example of prompts. So instead of asking them when there was a recurrence of the cancer, did they choose chemotherapy or surgery? This is an open-ended question, and then these are prompts. So so everything is built on paper, and then as you go into the field and start your data collection, the topic guide will adjust according to the findings from your interview. So there's this idea of can I use the first version of the interview as the pilot? They call it. Some people refer to it as the pilot interview for my data analysis, knowing that actually they often come to it from a quantitative background when they say that the pilot questionnaire cannot be used. But in qualitative research, the first two interviews are actually for you just to adjust. But very often, if you've built a pretty solid topic guide based on existing theoretical framework, you should be able to get some useful data there already. So it is valid for analysis. There may be some adjustments to the topic guide. So the ending is that you thank the participants. You may want to tackle any questions or misconceptions, especially if it's related to something that impacts their health. You could provide them with contact information if they come up with new information. Some books that you read would mention that you can either re-interview them if you want to, or you can do something called member checking. So member checking is kind of like a quality measure where you ask them as a participant to check on post-interview how you're using the data. So it could be something simple like asking them to check the transcript to make sure that this is transcribed correctly, but that really is not necessary, I feel. But it could be something more complex, like if you're doing research on a vulnerable community and you're afraid of the way that you may misrepresent them or present them in a way that creates more prejudice, then you may want to send the results back to the members of the community before you proceed with presenting it to a wider audience. So just recap, a summary is that a good interview guide will cover the range of topics to be discussed. It's not extension of your own views on the topic, but it allows you to focus on the participants' views. It's got to be flexible, so many and during the interview, and may require many revisions. Okay, so I'm not going to cover conducting interviews. I think that was more a practical session that you do yourself. So at this point, I'm just going to pause. I give you I give you an example of a topic guide that was constructed. So this was a person who wanted to do the clinical practice guidelines, and they had knowledge, attitudes, and behavior. This was a clinical practice guideline adherence model published in JAMA, so pretty good model. And when this person who was doing qualitative interviews for the first time did this topic guide, you can see that this was the first version. And it was about, I'll give you, let's look at question number 2. I'll give you several case scenarios to determine how you manage patients diagnosed with colorectal polyps after they had a colonoscopy. When would you schedule the following patients for their next surveillance colonoscopy? 60-year-old, 3 colonic tubular adenomas, each with polyps of 5 to 8 mm size. This was his second question in the interview topic guide. Any comments? What is wrong with this topic guide? And then you can see question 3. Too narrow, very narrow. Yeah. So you only have it's almost like asking a person to answer exam questions. Yeah. Um, there's no follow-up questions. Yeah. It's just here and then what's the pro of that? You're not exploring their decision making. So I think you can continue typing. I'll just give you what I managed to find the response that I had with him. So this looked more like from a quantitative survey. Some of the language may be threatening. For example, what will you do with non-adherence or deviation? Um, and then what's the best way to get people started talking on this topic? Something simple to kind of like an icebreaker. And so it improved very quickly. You can see, can you share with me your recent experiences of managing patients who had colorectal polyps detected and removed from their colonoscopy? And more open-ended questions for sure. So it's not that hard to adjust and make a good topic guide. So this is your planning, and then you have your conducting. So your planning, you base your theory. You've got some ideas about structure and question construction. But collecting, you're doing it with real people. So you're asking them about their views and opinions, and things that are less tangible like rapport, confidentiality, trust will come in. Usually we collect interviews in the information sheet. We'll say it takes 30 to 60 minutes. It could be shorter, could be longer, but you want to give them an idea of how much time they need to commit. So I just have one slide on conducting the interviews, is that you, besides the probes in your topic guide, you also have probing, which is the activity that you conduct in the interviews itself. So you can do a number of probing activities in the interview to get people to talk more or to expand on what they're saying. These are elaboration, tell me more about something, continuation, go on, clarification, where you feel there's ambiguity you want to resolve, attention, so this is just very simple, completion, you said that, so you're listening to the person and then please complete this story, this thought. And lastly, research textbooks will point out they can also ask for evidence. So how sure are you that this happened? Give me some proof about that. But you have to be really careful about this because rapport and trust could be broken if you push too hard. So let's say this is an example of a actual research interview that was conducted. So we were asking supervisors, what is it like to supervise clinical master students who are focused on becoming clinical specialists, but part of their specialist trainees, they have to conduct research. So in a way, they are forced to conduct research. And what is it like for them? So this supervisor said, the clinical masters, they tend to concentrate on their research, and their clinical works are affected. So this interviewer asked, why is it, that what makes them feel that they need to concentrate more on their research rather than their clinical works? What type of probe is this? Yeah, so Parvati says clarification. I will go with clarification as well. Just asking them to so you're asking the interviewee to clarify this statement of they are more focused on their research than doing clinical hours. So yeah, so these are more skills than probes themselves. I'm just a bit aware of the time. Can I just take another 15 minutes to finish up the analysis here? So where we are now in the method, in the actual conducting of the research, is that you have all these interviews that you conducted. This is an example of a transcript. So all the interviews will be transcribed verbatim, and you want to start analyzing these transcripts. How do you do that? how do you move from something that's like this into reporting a paper? So there are, of course, software they can use to start to manage the data and to conduct something called thematic analysis. So these are some examples: MaxQDA, Atlas TI, NVivo. The key thing is that actually, the question was always asked to me, do this do the analysis for me? And in the past, I used to answer no. But with at least Atlas and NVivo for sure have started to incorporate some kind of AI tools, which when you think about it, they very easily summarize themes across the range of transcripts, interview transcripts that you have. I think eventually you'll see as the validity becomes more and more tested, becomes more trustable, you might see the AI analysis being an actual step in qualitative research. So what is thematic data analysis? If you've read or used qualitative research, you will know that they usually say there are certain set that some themes emerge from the interviews, and then they have they will talk about the themes as well as provide some quotations to back up those themes. So the one that I want to introduce to you, which I think is very systematic, is actually this thematic analysis by Braun and Clark. So Braun and Clark are two psychologists. They published their paper in 2009, and then you can see that by 2002, they have a very significant rise in their citations because their methodology, their approach, as you can see, kind of makes sense. So they published in 2006, thematic analysis in psychology. They said that they want to do a kind of thematic analysis that's accessible to students and those not particularly familiar with qualitative research. So this was their 6 phases. This is a process of how they advise people to do thematic analysis. I'll just show you a bit more clearer here. The first step is that you familiarize yourself with the data. So it involves transcribing and reading the data. The next step is to generate the initial codes. So you code sequences of sayings across the entire data set. And then from these initial codes, it's a long list of codes. You then need to search for the themes. So the codes will be collated or collapsed into a few key themes. And then the next step is once you have these themes, you need to review them. They have 2 specific steps for reviewing the themes. And this will help you already start to have some kind of flow chart or map of the analysis. Once you have a clear map, you then look at the themes and then you think about defining and naming the themes so that they make sense to people who are reading them, to yourself as well. And then the last step is actually the part where you, from these themes and the way they've been described, you want to be able to put them into some kind of report. So here, this up until here, it's probably all still in the software. And then the report, of course, is you're writing up some kind of dissertation or some publication manuscript. So you familiarize yourself with the data by reading it repeatedly. You read it in an active way. So active means sometimes you make notes or you make case summaries about that person that you've talked to. You need to read through the whole thing at least once instead of just picking out sections to read. Start making notes. So this in NVivo is called a memo. So you make memos. And the process of transcription, I advise you to try at least once. It's really boring. And again, transcription used to be done by humans, but now you have a lot more powerful AI that can auto-transcribe, including, as we found in Malaysia with our heavy Malaysian accents, it's no problem here. So I think the same might already be available for in India. So generating initial codes. So the next phase after that, after reading through, is that codes are the most basic segment, or element of the raw data. So they need to be coded. The codes need the transcription to be coded. So it's different from your themes because you're just like, what is this? What is this? What is this? What's the label here? What's the label here? What's the label here? So themes are going to be in the next phase only. Codes are just labels for different things that people are saying about the topic. So let's say, for example, this is from Braun and Clark. It's too much hard work. So you can see it's too much hard work. How much paper I've got to sign a name. We thought about it half-heartedly, and no, I can't be bothered. It's too much hard work. So I think the we here refers to talking about a partner, and then it's too much hard work is the hassle. But you can see that their codes are much longer than what we usually think of as codes, then which are single 1 or 2 word lines. They are using much longer codes. So this is this was from the same topic example of the barriers to research supervision. So if you have limited time and you have to share that time with students, they find it difficult to prioritize. So I would code this as time limits. I'm giving you an example from an example from the research that I did. So clinical versus research priorities, so it could be double coded. So this is double coding one sequence of sentence, but there are 2 codes inside. And then this one is about why do they need to concentrate more? They need to do a lot of, they are unable to write. They find that when they are writing, it's difficult. They don't understand the points. The thesis is in English. So I would put this as something like writing issues. So I would code, just go through and then say, what is this? What is this? What is this? So there are 3 tips for coding from Braun and Clark. The first one is code for as many potential themes as possible. So just keep coding or double coding a certain sequence. Code them a bit more inclusively, which means that you keep a little bit of the surrounding data so that you know what the context is. And then lastly, you can code the data into as many different codes as they fit into. So there could be, so one sentence could have 2 or 3 codes to it. It's fine. Yeah. Because no data set is without contradiction. Yeah. So the eventual map does not always have to smooth out or ignore tensions and inconsistencies. So sometimes it's okay during the coding process just to put in as much codes as you want and then sort it out later. Now, the next one after you got your codes is you're trying to collapse all the codes into teams. So different codes combine to form an overarching team, and they suggest using tools to help you sort through the different codes. So there are tables, there are mind maps. I've seen people use Excel tables to sort through the codes. I've seen mind maps, of course, are quite common. And then we do this exercise in our workshops where we ask students to write codes on little pieces of paper, or we pre-prepare some labels, and then we ask them to sort it out, almost like, you know, on the table, and then they try and come up with themes based on those codes, and then they go around and they see each group has got a different way of arranging the themes, but they all have some kind of structure or that makes sense to them. So at this stage, some of the things you can do when you're looking for themes, think about the relationships between the codes, between the themes. You can actually have a theme called miscellaneous. In my software, it's usually Z_miscellaneous, so that I know very quickly where to look for it. Don't abandon anything at this stage. So you're still sorting things. Let's say, for example, this initial thematic map, barriers to research supervision in clinical masters. You then have I'm putting down barriers and facilitators as 2 main themes, and then some things emerge here. These are some of the codes that have been collated to get the codes go into the combine, and then become this kind of themes. So I have a rough idea of what I'm reading as I go through the different transcripts. So the reviewing of themes comes next. You want to be able to refine the themes, and there's 2 criteria that you use. So the first one is internal homogeneity, which is that when you look inside the themes, they all have to, the data, the quotations, all have to make sense that they fit under that theme. So very often I look at some students and then I look at their quotations, and I'm like, how come this is coded here under this theme? It doesn't make sense. And that's this step of checking, actually, the reviewing process. And then the external homogeneity is them 2 themes cannot be similar to each other. Yeah. So they have to have a clear distinction between the themes. the example of this is that when you find a piece of information and you need to code it in a team, and then you're like, I'm not sure whether you should go here or here. Maybe those teams are too similar. Okay, I'll skip this. This is a bit technical. But you can see that once you're sorry, this level 1, level 2 is actually elaboration of what I explained in the previous one. They just expand it a bit more. So you can see that eventually maybe the thematic map will emerge, where you have barriers, and maybe you've added one more from besides the training priorities, the lack of meeting time, the research guidelines are not clear. You also have facilitators, like let's say department support or faculty training programs. And the idea is that you cannot go on forever, because qualitative research, you can keep playing around with it, and you can go into a loop of endless recoding. So don't continue when you don't have anything substantial to add. So when at the end of this phase, you have a fairly good idea of what your different teams are. They are separated into clear teams, how they fit together, and the overall story they tell about your data. So phase 5 is this. You have this. You have developed a satisfactory thematic map of the data. You want to be able to then try to describe it and name the themes so that it makes sense to readers. So you're going to present these themes for your write-up, for your analysis. Try not to get the theme to describe too much, to be too diverse or too complex. So simple theme works best. Let's say this was the final one that emerged, that we decided to publish. We looked at this idea of barriers to clinical research supervision. And then there were 4 barriers. One is access. No access to supervision. Training priorities were limited for them to get research training. Research expertise for the supervisors was tricky. A lot of the supervisors we have in the hospital are trained clinical specialists, but not PhD researchers. And then there were varying research standards that made the students feel very uneasy with were they doing the right thing. And very often these research standards will only emerge during the viva. So this was the final thematic map as an example. And then sometimes in teams, there are sub-teams that you keep track of in your software. These are teams within a team, and you will describe them. So by the end of this phase, you have a rough idea of what your teams are, what they are not. You can describe the scope and content for each team in a couple of sentences, which is actually important for your write-up. The names that you choose for your teams need to be concise, punchy, and give the reader a sense of what the team is about. So that's the write-up process. You then want to produce the report. So you've got all your, let's say 30, 40 interviews. You want to be able to summarize it as a story that convinces the reader that what you're presenting to them about this topic is valid. So the data extracts that you choose, the quotations, need to be short enough, not very wordy. They need to be coherent, so they need to fit underneath the theme that you're describing. It's got to be logical. You have to avoid repetition in qualitative write-up, because it's a lot of words and very little diagrams. So if it's too repetitious, it sounds the same. Then it's probably best to move things together so that there's less repetition, and it's got to be interesting. So a bit of narrative storytelling, writing skills involved. Yeah. So in each team, you need to choose a piece of evidence, or 1 or 2 pieces of evidence. So the classic example is to choose very, very vivid examples, very vivid extracts. So the ones that that best describe it. So I remember for insulin, there was one where they said they're scared to start insulin because they think it relates to disease severity. And then one doctor said, well, when they start insulin, for them it's 1 foot in the grave already. So we immediately went with the 1 foot in the grave quotation, and we put that in the write-up. So this one, I'll show you what happens eventually. You write up an article. So this was published in the Malaysian Family Physician. And then these are the 4 main themes, as I said. that when people want to do clinical research, they lack access, they have training priorities, conflict. There's a lack of research expertise on the supervisors, and then there are varying research standards. This is how it's written up. So you have the limited access, which is the first team, the first team here. The first team here, and then you have the write up with some description of the sub teams, or what the findings are. Let's say the first 2 years were important; they really couldn't get access, and then the issue of the offsite placement, and then lastly you put in a quotation. So when they go outside, when they get training outside the university hospital, they are much busier. Their clinics are heavier. They get allocated time for classes, but I think in major health settings, there's not so much allocated time. I'll just take 5 minutes to do grounded theory. So this is the main thing already. You've done the topic guide, how to set it up. You collected the data. You know roughly that there are 6 steps that need to be done to produce the thematic report. And this last bit is it's not going to be anything important, but it's just to show you that when you're choosing to do qualitative research, you need to be aware that each approach that you choose has got some kind of like a school behind it. So the idea is that you need to choose an approach that fits. Yeah. So these are some of the common approaches that you have. Narrative. This is from a classic book by Creswell, which is like he's a guru of qualitative research, and he wrote a book that said these are the 5 most common approaches to qualitative research, because people were struggling with this exact same question. So he listed down 5, and that book breaks down it according to a very specific format, which is what's the definition, where did this thing come from, what are defining features of each one, are there different types of ethnography, are there different types of phenomenology? For sure there are. What you want to do of a phenomenological study, what are the steps involved? And then he's like, these are the challenges that you're going to encounter if you choose this qualitative research approach. And so it's just a repetition of that format. So I'll give you an example of grounded theory. So the idea is that you want to move beyond just the themes. You want to discover a theory. Yeah. So you want to move towards this kind of generating a theory from the ground up. So it's instead of so you want to generate a theory from the participants instead of taking something off the shelf or from literature. Yeah. So you start with one participant, and then you interview an increasingly large number of participants in order to build an understanding of a certain topic. So you can see that just that explanation alone is an overview, but there are lots of specific things that go into actually practicing grounded theory. So I'll give you an example of let's say this one, the inductive approach. So like in the thematic analysis, we said there are 6 steps to do thematic analysis. In grounded theory, they will have their own definition of how you want to do coding. So for example, in grounded theory, they use these terms that when you do grounded theory in that coding, you have to start with open codes, which is the line by line coding. This then collate into themes that are related to each other, but this, instead of using the word themes, you use the word axial coding because the codes kind of like form around different axes. And then lastly, when it comes to writing up, you're not going to report all the axial codes, but you're going to be very selective because you want to be able to tell what the story is. So you you only do selective coding. So you can see that that this school of qualitative research has got its own methodologies involved. And then it has its but generally you can see that when you want to do grounded theory, you've got a same kind of process as what we covered from Braun and Clark's and the previous data collection process. The research question must fit a grounded theory approach. You can you need to do an interview that focuses on the experience and the process in order to saturate the model. So until you don't hear anything new, then you know that your model is saturated. So there's a simultaneous and iterative data collection because you don't really know what the categories are. So as you interview people, you code, you interview, code and interview. So it's back and forth between coding and data collection. And then you have these very specific types of coding. And then you finally arrive at a higher level theory that explains the process that is the focus of the study, which you then can present as almost as a theory instead of just a set of themes. So an example of that this school has got its own challenges when they say you need to build a theory from the ground up and you need to set aside all your prior knowledge. Is it really possible to set aside all your a priori knowledge? Can you just erase all your data? Can you bracket out your previous experiences in order not to have any bias on the interpretation of on data collection? It's probably impossible. It's very hard when they say saturation. When they say saturation, the concept of saturation is something very ambiguous. So people always question, how do you know you've achieved saturation? And some steps, although they say you have to do them, they're less clearly defined, even in methodological books. So for example, they give memoing. Memoing is important, but what really is it? Is it just writing your thoughts about the participant or about the topic? Okay, I'm sorry I took us so much time, but really the art of quality analysis can only be learned by doing. So I hope this gives you the ABC of data collection, data analysis, and lastly, just making you aware that there's a whole bunch of background things that you need to be aware when you choose a particular approach or school of qualitative research. Okay, so thank you.
Thank you very much, Dr. Lee, for this insightful webinar. So I'd like to see the participants if you are having any queries so that you can ask or you can type in the chat box.
Yeah. Yeah, so I'll just pick up on some of the questions already there. So software in identifying main themes that I think if you look for NVivo and their AI component, their demonstration on YouTube, you get a good idea of how their AI software works. And it does generate main themes. I think it would very quickly give you a good starting point. I think what NVivo does is it's based on on content analysis, which is which is a type of qualitative analysis that we often do in healthcare research, which is we're looking at what does the person say and what does it mean. But there are other types of qualitative analysis, for example, linguistic analysis, where you analyze the interactions between the patient and a doctor. So if a doctor says this, and does it push the patient to say a certain thing? Does it close up the consultation or does it open up the consultation? So those types of analysis, I think at this point, AI cannot do, but for content analysis, AI can.
So Dr. Lee, you found NVivo as a helpful software in medical research, like more helpful than others.
It is more helpful. I don't see any drawback apart from the fact that it's not auditable. So if you one of the key that I'll just type it here. So Lincoln and Guba were two researchers who set out four quality criteria for, they call it rigor in qualitative research. So they wanted to give people something similar in qualitative research that was related to the concepts of validity and reliability that were applied in quantitative research. So I think a lot of this had to do with that if people look at your transcripts, are they able to track how you move from transcripts to your final themes? And there's like some kind of audit trail for that. But if you're using software, then it's like a big jump lah. It's just from transcripts, unstructured transcripts into 4 or 5 themes. So I'm not sure about. No one has actually talked about it yet in terms of the rigor. But I think these conversations are emerging.
There is a question by Dr. Upendra.
Okay, so Dr. Pendra asks, quality research finds competing interests with other forms of research, even mixed methods analysis during publication phase. Anything specific that one should keep in mind while conducting and more publishing qualitative research? So you have so mixed methods. So I address two. One is actually that you in mixed methods again, Creswell is a very good author who has again, he's probably the main reference text for mixed methods research. And so he has a clear step where he says that if you're doing, not only does he say that if you're doing quali first and quanti first, what's it called? I think it's called explanatory. Or you're doing quanti and then quali is exploratory. But he also has, then you have the parallel designs. But he also has this discussion about how do you then reconcile or do a synthesis of the two results. So you can, and he acknowledges that sometimes you can end up that they are explanatory or they are confirmatory of each other. So the quali just adds, let's say, to the quanti prevalence or quanti patterns. It helps to explain more depth why those patterns emerge. But sometimes they're contradictory, and then you specifically have to resolve them, and then you have to acknowledge that, and then you probably have to then think of why you have this kind of opposing results, which is actually very interesting in research. I think the other one is that you may find some results that are contradictory, it seems, to the literature that's been published. I think research is always open-ended in terms of that kind of dialogue. So in fact, we would be excited to see that. The early days of qualitative research, when I was doing it in Malaysia, at least it was always that much has been published about this topic in Western literature, but little is known about it in the Malaysian context. Therefore, it's important to explore this. And very often you find similar findings, but because it was so rare to see qualitative research from a lower middle income country, it was still publishable. But increasingly, you find it harder and harder. A lot of comments will come back. This is already known, or I mean, lots of people are publishing from this part of the world already. So then sometimes the things that you find if it's contradictory is actually better for you in terms of publication.
Thank you, Dr. Lee. Dr. Vijay has a question basically on reliability or validity part of the qualitative research, how to reduce that bias and maintain a high reliability and validity.
So for that, let me see if I can find the slides. So the quick answer is that they don't use the terms reliability and credibility, but they change it reliability and validity, because those are calculated using statistical approaches. So reliability, I can't remember exactly now, but I think they will rephrase it, but you're looking at the same thing, credibility. So for example, the concept of reliability in quantitative research is that if a person repeats the exact same experiment, will they be able to get the results? Are those results reliable being published? So in qualitative research, it's credibility. If can I trust that your results are valid and accurately reflect the views and experiences of the people that you've interviewed? So I'll give you an example of some things that they discuss. For example, they say there's theoretical validity. So they actually do use that term validity, even though it's under credibility. But it's like if you found, let's say, this set of themes, and you look at a theory that someone has published elsewhere that's with some set of criteria, does it match up with that theory? Then you roughly know that what you're exploring or what you found is not too far off from what other people have also said might be happening in this area. So you can see that it's not statistical, but there is some form of trying to match the idea behind reliability. I can't find the slides, I'm sorry. But if you look for Lincoln and Guba, you look for rigor in qualitative research, then you will get very quickly to those 4 sets of
I had a question that I wanted to know, like, who should be the part of team for conducting a qualitative research, like essential part and maybe desirable part. Who should be there? Since you have experience in conducting a qualitative study, is there some people who should be in your team before you start a qualitative research as a starter?
Actually, not really. I don't think there's any as long as they've had some kind of like qualitative training, some experience, then that would be helpful enough. Unless especially for this kind of content thematic analysis, you're looking at more specific things like discourse analysis, like transactional analysis, which are more linguistic. Then or let's say if you're analyzing, I'll give you an example of one I'm working on, where this person is going to take health campaign posters and analyze them in a multimodal format. So she looks at color, she looks at placement of the words, she looks at the images of people that are used in those posters, and then she produces analysis of the visual discourse. So if you ask me to do that, I would have no idea where to start, and I would definitely need someone who's from a discourse and analytic background.
Maybe it's based upon the topic which you are selecting, so you may need somebody, in that way you are saying, like some specialist, like you need it for building that poster sort of thing, that you need a person, a specialist to see that the poster which you are making or the campaign which you are starting is in the right place. So that's what I have to say.
Yeah.
Any other question?
Yeah. So context.
One question is from Dr. Priyanka Kapoor. Same thing.
Would it be? Yeah.
Content.
So I think the content experts, we've worked, of course, with the experts, and very often I mean, at least in the faculty of medicine here, it's usually the content expert is a clinician who is interested in a topic, and then they come up with the research question, and then I help them, as you've seen in that, develop a topic guide, train them on doing interviews. So Vijay there's one from Vijay. The methods to reduce bias in the quality research. So there are so there are always the usual ones are I can think of a few lah. One is actually you have an audit trail, so you have from the codes that you have, and then how you move to the themes, you have to save each version of it so that people can review if they want. I think the other one is that you're always maybe if you have especially for our students, we ask them to check in with us. Where are they in their analysis? So there's some kind of like presentation to research supervisors. So it's not just one person looking at the data and saying, and this is the way the data should be interpreted. And so there's another one called inter-rater reliability, where you have in the software, for example, 2 people can code one piece of data, and then they generate like an overlap, something like a agreeability score. between how two people are coding the same transcript and the codes. The other way is the other format of bias that I've mentioned is that people do member checking. So when they finish the research, they present back how they want to report the results to the community members. I think another one that you may want to consider, which is more embedded, is actually this concept of CBPAR, which is community-based participatory action research. So this one is the idea that instead of being extractive, when you go in and do research, you're just extracting information from the community in order to get your publications. What you're doing is you're actually keen to work with the community. So this is a particular design where the community members are actually part of the research study from the beginning. They're part of the research team from the beginning. And they help refine the questions you're asking. Is it important to ask this question?
Okay.
I believe that it concludes our Q&A round for this session. There are no more questions. So many thanks to our speaker, Dr. Lee, our panelists, and the participants for being a part of this session. So I'd like to request all the participants that I'll be sharing a feedback form of this webinar via your email and WhatsApp group. So kindly note that to receive your e-certificate, you must complete the feedback form by the end of today, so that we'll be able to mail you a e-certificate. Now I'd like to invite Professor Abhishek Mehta to conclude our webinar by addressing our participants. Sir.
Thank you, Dr. Lee. My heartfelt thanks. You took out time for us and really patiently you explained each and everything to us. Really heartfelt thanks from all of us, from all the core team member and all the participants. Yes, some people are writing a very nice session and all. So that's what is our feedback actually. We don't need a feedback form. It's just to give them ease. I'm really thankful to you. And
yeah, thanks very much for inviting me.
Manu, if you want to say something.
I think, sir, you said the right thing. Fantastic session, Dr. Lee. And I think if you read the chat, I don't need to say anything. Just to add on, we have always been told that what gets measured gets done. But there is a phenomena which goes behind this measurement. There are behaviors, there are perceptions, there are various things which can only be enlightened by qualitative research. Thank you, Dr. Lee, for taking our time. It's a very ambitious project which we have embarked onto, and we look forward to your cooperation. And I hope we can meet you in person in a sunny climate sometime soon. Thank you very much. Thank you all for participating, and we hope to see all your feedback forms very soon. Thank you.
Thank you, everyone. Have a nice day.
Thank you.
Thanks. I'll leave first. I have to collect my son.
Thank you. Thank you, sir.
Thank you, Kazim Saab.